Welcome back to RC Talks with RC Hospice. My name is Esther Narcisian. I'm the Director of Operations and COO, and I'm accompanied today by
Erika Jones.
She is our registered nurse case manager and has been with us for how long now?
Almost 4 years.
That's so amazing.
I know, it's crazy
I
fast.
remember your first interview. It was love at first sight, people. We just knew Erika was going to be a part of us.
Yeah.
So Erika, tell me how long you've been with the company again and what your favorite memories are so far about RC and what do you like about hospice?
So I've been with the company, it'll be 4 years in December. My favorite memory of the company is our staff meetings. One of them, we did games where we played bowling and just the bonding with all the different disciplines and seeing them interact, and we're talking about the different circumstances we find ourselves in when we're on the job and just that type of bonding with the other team members. That was my favorite memory.
That was actually really fun. I remember the balls were going everywhere.
Yeah, that was really fun. Yeah.
And tell me about hospice. What is hospice to you?
So hospice to me is entering a very vulnerable place with people and family members that they're allowing us in, which is such a privilege. And it's not to interfere, but actually come alongside them like partners.
I love that.
And to help them in their journey, whatever that journey looks like. And it's different for everybody.
It is.
And it's really a precious, sacred spot, and I really hold that dear.
Erika does our palliative care program as well. She's actually the main case manager for palliative. How would you describe palliative care, and then tell me what the differences are for you for palliative and hospice?
So I would describe palliative care as more like just an extra set of eyes.
Okay.
Palliative care is more restrictive as far as all the accessibility that is available compared to hospice. It's more limited in its scope or area that we cover. That's definitely more educational and to empower family members and also to inform the doctor what's going on.
Absolutely.
But as far as interventions, it's pretty limited of what the nurse can do.
Yeah.
It's a lot of education.
Would you say it's also advocacy? Like, do you feel like you advocate for the patients being an RN?
100%. Making phone calls for the doctor with the patient, helping them make appointments with the patient on the phone,
great.
and explaining to them what the doctor said or going over like test results that they have.
Yeah.
So definitely advocacy.
I myself can sense how much that could give peace of mind knowing that a nurse is going over my test results with me. Sometimes at the doctor's office, and no blame to the doctors, we know they get so busy and all that stuff, and I think it's just having, like you said, that extra set of eyes, that knowledge. I think it gives people, especially the patients, so much peace of mind.
I agree. Yeah.
Now tell me about hospice. Like, what would you, because a lot of people, palliative care is the umbrella and hospice care falls under it, right? It's kind of like symptom management, sort of. So tell me what hospice is specifically.
So hospice is end-of-life care.
Okay.
So it's comfort care, it's end-of-life care. You have a terminal diagnosis, you're not seeking treatment anymore, you're not trying to do all the options, you want to be comfortable, you're not aggressively pursuing treatment. And so hospice care is definitely more hands-on, with the nurse being more proactive and getting orders from the doctor, and definitely even giving medications, where palliative doesn't give medications like that.
Very true.
So hospice nurses do wound care treatment, we do Foley flushes, we do all different types of arrays.
Yeah.
And that's not the case in palliative. It's definitely palliative is more educational. Whereas you do educate in hospice, but it's definitely more hands-on. And the nurse is available and can frequently visit the patient, whereas palliative, it is a little bit more restricted.
So palliative care, I always said it's like concierge medicine, kind of like we're the eyes and ears for the doctors. We give the information as much as we can, we educate, and then hospice care is way more hands-on. Not only do we educate, but we're also there hand in hand doing it with them. Now, do you feel like RC Hospice Care does something more than other programs you've seen?
100%. The supplies we offer to the family members and the different types of discipline, like our Veterans Affairs chaplain, that is very unique to RC.
Yeah.
I would say the different types of supplies that we can provide the patient, also just the 24/7 on-call backup and the education and the support.
I know that you do some on-call too. And what's the difference for you when you do call versus your regular routinely visits?
So on call, you're definitely responding. It's not a crisis. Sometimes it is, but it's definitely like an as needed, like something's happening. So there's more tension in the air. There's more dynamics with the
Stress,
family. Yeah. Sometimes you're arriving at 3 o'clock in the morning
Yeah.
and you can't find the house and you want to make sure you have the right address. So
I
you're
know.
trying not to provide, like, give like a creeper, right, view
I
with
know,
your
I
car
know.
going by the
And you
house.
turn the lights off because everyone's sleeping.
Right,
Yeah, I know.
So it's definitely more tension, the on-call, because you're responding to a need.
Yeah.
Whereas the scheduled visits are more laid back. They know you're coming. They know what time you're coming. It's kind of an anticipated
And
what you're
it's
walking
your
into.
patients versus on-call can
Yes.
be somebody else's patient.
Yeah, so you're trying to get the history and trying to assess the situation and see what's going on and how to, resolve it.
We actually had a situation where I had to go with the nurse to translate. I'll never forget. It was like middle of the night, and I'm the type of person, I don't know what it is, like in awkward situations, I'll start laughing. Like, it's really bad. After my dad died, it's a weird thing that happens to me. But I remember getting to the patient's house, and they're Armenian, and they're trying to talk to me, and the entire time I can't stop smiling, and their loved one's like in pain, and I was like, oh my God, I'm like, I swear I'm normal. But
Yeah.
I mean, it does get like that where you actually even have those nerves. It's the middle of the night, you're exhausted, they're exhausted, but it's interesting. Have you ever had a situation where you went to the wrong house?
Yes. Only once.
What happened there?
Once. This was actually kind of sad. It was actually during the day. It wasn't even on call.
Oh my God.
It was a scheduled visit. I went, the house looked exactly like my patient's house. It was just one door down.
Oh my gosh.
So I rang the doorbell and the person looked immediately confused. And I was like, is this such and such number? He's like, no, it's that way. And I was like, oh, I'm so sorry.
Yeah, that's weird. And they're like, why is the nurse in front of my door? Yeah,
Yes.
no, that's great.
Only one time in 7 years I've been hospice nurse. So not too bad.
I love that. Erika, what's one takeaway you can give us or our viewers right now?
I would say the one input I would give is to enjoy every moment. That life changes so fast. Things can happen of hospice, especially in hospice, but even outside of hospice. So really enjoy the time you have with your loved one. Enjoy the moments that are good and even the not good moments, because we all have not good moments. We all have yucky stuff going on. We're all super busy. We all have some type of dysfunction. And just to know it is part of the process of just life. And it doesn't have to look pretty, but overall the picture is beautiful.
I love you. And then last thing, a bunch of our patients and their families have been watching our videos. Anything you want to say to them?
We love you guys. Keep your lights on so I can see your address.
Thank you guys so much for watching our video and being a part of the RC team and family. We look forward to talking to you guys again soon.